Talk to us about hashtag Choose to Vaccinate and your aims there.
We launched a national campaign for COVID vaccination because we believe that it's very important for all individuals in our community to get vaccinated. At this stage, we believe that if we reached more than 50% of our population vaccinated, it's definitely the adult population. We believe that this will provide us more protection against COVID. So we advise everyone to be part of the team who break the chain of infection and triumph over COVID-19 and get vaccinated as soon as possible.
I mentioned milestones a little earlier on, the UAE becoming one of the first countries globally to approve emergency licenses for the vaccine. Now, of course, being recognized as one of the most efficient in delivering the vaccine as well. How important is that to you, to your team, to health authorities, not just in Abu Dhabi, but the whole of the United Arab Emirates, to see these achievements get results?
Definitely it's really the pleasure to see all of this international ranking that we see for UAE. We could not reach this success without the support of our leadership and their commitment with us to ensure the safety of the community. I see the figures with really happiness, and although we put a lot of efforts in the healthcare, but we see these efforts really translated into actions, and also we see the change that happens in our community. So we are really very pleased.
Extraordinary efforts from the health authorities here in the region. However, you do need residents and citizens to adhere to that advice and to get vaccinated. To that end, you've been kind enough to come on and answer some of the questions that are coming into us this morning, flooding into us. One of them, Dr. Farida, that occurs time and time again, is why the need for 2 doses? Why the need for 2 shots of the vaccines?
Well, it's really depending on the type of the vaccine. Of the vaccines currently require 2 doses. The second dose is really to enhance the immunity. There is a level of threshold that we need to reach to get a good level of protection. So based on the studies that have been conducted in UAE and other countries, we believe that it's better to take 2 doses to get the required enough level of protection.
Another question that is recurring for us, and I know it is something that you're trying to get the message across, is people saying, okay, where do we book appointments? Is it key for us to mention to people that they do not need appointments?
Well, we tried our best to provide the vaccination in many outlets. Some of them will require appointment, but others are available for walk-in. We do have the vaccination available in clinics, in different clinics, and also it's available in majlises and in some of the drive-through centers. So it's better to book the appointment in advance, but also in certain locations you can really access the vaccine easily and on time. It's also available in the different outlets of the private sector, especially the major providers of major hospitals in the private sector. So again, if you are following any of those private sectors or you are a patient there, you should ask for it and hopefully get it as soon as possible.
We understand that obviously senior citizens and those with chronic diseases are being prioritised at the moment to receive the vaccine. Lots of questions though coming in, Dr. Farida, with regards to other parts of the community, be that tourists coming in to the UAE or of course children as well. Any information you can share with us with regards to the extension of the vaccination programme to others?
Well, currently the vaccination is available for all adult residents and nationals in different locations, as we said. For tourists, it's currently not provided. The priority is definitely for the high-risk and elderly population, but we also make sure that anyone who is above 18 have the good access to take the vaccine.
Other questions coming through with regards to the period between taking the first dose and the second dose. Should one test positive for COVID-19 during the 2 doses being administered? Is there any change there? What happens then if one were to test positive?
There might be some change needed required based on his medical status. So what I would advise is he needs to inform the doctor regarding his infection. Maybe there will be some delay, or he might get it on time, depending on his health status. Sometimes, actually, majority of times, the doctor might request immunity test to check whether the current infection will provide enough immunity, or he will require another booster dose. For most of cases who get asymptomatic type of illness or very mild symptoms, they might really require the second dose, because this type of infection, in most of the asymptomatic cases, the immunity is not enough to protect him from another attack.
Others texting in asking about the protection that various vaccines offer at the moment. We know that 2 have been approved here. Can you just clarify for us that the vaccines that have been approved within the UAE, both of those vaccines protect against COVID-19?
Yeah, it's a very important question, Tom. Thank you. The protection that we are looking for is first the protection against complications and death. And both vaccines provide 100% immunity. In other words, if you take the vaccine, you are protected from the complications of the illness, regardless of what type of the vaccine that you are taking here in UAE. And this is the most important message that I would like to emphasize on.
Dr. Farida, it's always lovely to chat with you. Thank you so much indeed to you and your team for everything you're doing for all of us in the fight against COVID-19. That was Dr. Farida Al Hosani, the Director of the Communicable Diseases Department at the Abu Dhabi Public Health Centre, joining us live on the line. And of course, reiterating